Back to this morning's discussions. I have the distinguished honor of presenting to the group Dr. John Roberts, who's extinguished, not distinguished, intelligent and smart, and one of my best friends in the world. We met at Capital University. We became almost like brothers. Went to England to visit him and see his fantastic office, which is kind of like in a mansion. And he has been, of course, in the dental world in the UK as the outcast IAOMT past president there and IABDM representative. And he is just the all-round great chap that you see this morning. So without further ado, I'd like to introduce to you my best friend and brother, John Roberts.
Thank you. Now, this is a presentation I've been given by a company whose products that I use. The company is called Guna. So you'll see me referring to Guna a lot. I have no connections with the company whatsoever. I don't get paid to do anything. This was just merely, I met Dawn and I met Mike, and I said, you know what, there's this great medicine we're using in Europe. Why don't you let me come and lecture about it? And I was away with my good lady in Scotland, and Shabir was with me. We're having whiskey at 4 o'clock in the afternoon with some friends, and I got a phone call from Mike saying, do you want to give us a lecture? So I thought, hell, why not? You know, didn't think about it, just thought, here I go and I'll come. So some of the slides are mine. These are the ones that have been added, but the handout is the information that you all need. Equally, the presentation was 5 hours long. In fact, this is taught over a weekend. So I'm sorry if I'm going to skip over subjects, but what I want to do is to give you an overview of what it was all about, and then please see if we can get Guna or other people to come and really show you how to use it, because it is such an exciting use of modern medicines. But I'm going to try and not to read off many slides, but the information presented here is not to be considered a prescription, and we do not accept medical or legal responsibility for misuse of the information presented. I will probably misuse it a little bit. This information is for educational purposes for licensed healthcare professionals within their scope of practice, and I'll try and allude to that as we go through. But a little bit about me. Me, like Dawn, like Mike, like my friend Shabir, be crazy, stupid, weird and strange, whatever, because you know what? I just want to be happy, and I'm happy here with all you guys, and that's what it's all about. The great aim, and I got my spelling wrong, so I'll just get that out of the way to begin with, is not the great aim of education isn't knowledge, because I've got friends who know everything, but it's getting off, and someone else has already sworn, but get off your arse and do it. And this is a medicine you can start using straight away once we find out where you can get it from in America. For me, this is something that I have always lived by. And again, this is another slide I'll read, only because it's so important to me. Da Vinci, probably the cleverest man that ever lived. And if you get a chance to go to Milan and see all the things, it's wonderful. But an insatiable, curious approach to life and an unrelenting quest for continuous learning. That's what you're all here for. A commitment to test knowledge through experience, persistence, and a willingness to learn from mistakes. Difficult with our boards and the way we're looked at these days, but you know what? That's why we're here. That's why we cultivate our skills. The continual refinement of senses, especially sight, to enjoy the experience, to embrace the willingness to embrace ambiguity, paradox, and uncertainty. The development of a balance between science, art, logic, and imagination. That's why we're here for, and I'm going to show you medicines that blend the two of them together. A cultivation of grace, ambidexterity, finesse, and poise. Let's just enjoy life. And then a recognition, and this is the real capital theme. Capital University was just the best experience for those of us who experienced it, and everyone who went through it will nod their heads. You know, we just think about it and smile. A recognition of and appreciation for the interconnectedness of all things and phenomena. And I'm just going to go and get my book, because I was sat at the back during that last lecture and the lectures that had gone before. And I'm thinking, they're telling me all the things I'm going to be lecturing about. Digging one's own hole is what John was saying. But you know what? If my hole encompasses someone else's hole, we have a bigger hole to give more variety. So I've been trying to work it out. Okay. Inflammation. And the immune system. That's half my bloody lecture. Okay. Breathing. That was the lecture yesterday. Thank you very much. The Krebs cycle. You know what I wanted as I was a student at university? You know one of those big things you could stick on your door with the Krebs cycle and all the... I still can't remember it, but I've got some slides in here. Thyroid gland. Big on the thyroid gland in here. I'm also going to do some other things. I am going to get some quotes from people you wouldn't expect. I'm going to talk about IKEA. Do you all know IKEA? Yeah, we do in England. And there were some other great things. So hopefully I can incorporate all of those in as well. But again, let's carry on. As you can guess from my accent, this is where the language comes from. So I can be clearly misunderstood, which doesn't make sense. And obviously I'm acting naturally at this moment with a camera and a suit on. How can I say? Seriously funny. Well, hopefully some of that will come through. And I was happily married, but I'm happy you don't have to be married to be really happy in a relationship. So let's just wait and see on some of these things. But for me, very simply, I'm a simple man. And let's keep things simple. If the stone is wet, it's raining. If the stone is dry, it's not raining. If it's white on top, guess what? It's snowing. That's easy, okay? That's the level that I live my life at. Okay, and can someone say, where is this? Where is that? Correct. But it's a matter of how you look at it, because there's the same place. So what we do is we look at things slightly differently. Still the same thing, but we see it differently. Anyone know where this is? And you have to go there. I was there, and it's great. I went to the Barcelona Marathon this year. Didn't say I ran it. I was the drinking support team. Whoa, those people who couldn't run it, I drank for them. It was great. But there it is, in perspective. So again, put everything I say in perspective, but also don't lose the beauty of what I'm saying, okay? Because it is real. Now, this is something I'd like you all to read, and I tell you why I want you to read it, because I can't read it, because I get emotional every time I read it. So I'm just going to give you a minute. It's 1 minute of my 90. Can you see it at the back? Okay. She let go. Without a thought or a word, she let go. She let go of fear. She let go of the judgments. She let go of the opinions swarming in her head. She let go of the committee of indecision within her. She let go of all the right reasons. Wholly and completely, without hesitation or worry, she just let go. She didn't ask for advice. She didn't read a book on how to let go. She just let go. She let go of all the memories that held her back. She let go of all the anxiety that kept her from moving forwards. She let go of all the planning and the calculations about how to do it right. In the space of letting go, she let it all be. A smile came over her face, a light breeze blew through her, and the sun and the moon shone forevermore. Written by a man, by the way, okay? So we come into these and say, oh yeah, what can be new? But we're already judging before you even see what we're doing. And we have this, and one of the most pain-in-the-ass lecturers I ever saw taught me that. He says, if you think you know, you're already blocking and stopping things coming in. So I do hope that this can give you something if you're able to free up your mind. What is absolutely fascinating, Guna have the most amazing remedy for letting go. And we all see people who do batch flower remedies, or they do homeopathics. But if you take a batch flower remedy and you let go of the emotions, it has to have a physical effect on you as a human being. And so what they've done is they have blended the batch flower remedies and homeopathics to help you let go on the emotional and the physical levels as well. That's thinking outside the box, but it really goes. Now, letting go, if you listen to what Mike Margolis says, is lung large intestine meridian, lower 7 and 6, upper left, or upper 4s and 5s. So if someone's really, I don't want to have this root canal, I don't want to have this root canal out, give them some of this, You deal with the emotion that goes with the meridian, and all of a sudden, they're so grateful you've had the tooth taken out because you've helped them let go. Front four teeth, kidney, fear. Help them deal with the fear, and then they can let go of those teeth, and you've dealt with the emotion that is with there as well. That's real integration. I'm going to rein it back in a little bit, but that's how I view a lot of these things. So they even give you affirmations as to what you can use to help people let go. But what I want to do is to give you a paradigm shift. And I'm actually speaking in my posh accent, because if I start talking like this and I come from Liverpool, then there's 4 great men who came from Liverpool, and my mum and dad used to go and see him. And one of the guys says, when I want to start a revolution, I meant was start a revolution. This is going to be a start of a revolution, and it's going to start in Europe, and it's going to come over here. Why? Because it works, and it's bloody good. Equally, in the age of information, ignorance is a choice. People don't look, they don't want to read it because they're too challenged, they're too afraid. We see it with mercury, we see it with fluoride, we see it with root canals. Give people the information, let them make a choice. So you've only got 3 choices in life. You're either going to give up, give in, which is what our colleagues do, or give it all you got, which is what I think you guys are doing. Now we're on to the business. Okay, that's me getting out of the way. The jacket's being undone. The jacket's going to come off in a few minutes. But this is something, and my Italian isn't good, but it's talking about the biological effect, the biological effects of nanoconcentrations. Published in magazines in Rome, let me just get this right, Siena, Parma, and I just kept saying Pavlova, but it's not Pavlova, that one, it's something else. I just can't write it. So this is being published, and this is being published in Italy, where there are 5,000 homeopathic physicians, and, 8.2 million, I don't know what the population of Italy is, I would think it's about 40 million. So you're talking a high percentage of the population are using homeopathic medicine, and a high proportion are saying they were helped by the treatment. It's not the only thing. And you know what? I'm talking about homeopathy. Let's take it on. A history of low-dose medicine research, and this is 2009. I have to read this because, again, I'm sorry it's so small. Since the second half of the 1980s, the development of psychoneuroendocrine immunology concepts resulted in a change of perspective from the separatist view to a unifying view, and we have a separatist medical system at the moment, relating to the interpretation of biological functions of the body. That's what I'm going to try and show you. A key point was the recognition of the importance of continuous crosstalk between cells, organs, systems in both physiological and pathological conditions based on the fine regulation between messenger molecules. We know all these things, but we're trying to put it all together. Interpreting the pathological phenomenon as an imbalance between intercellular signaling. We're just not talking to each other. Me trying to communicate with Mike, my fault, I didn't communicate well. The administration of low physiological doses of messenger molecules can be considered intriguing and an innovative approach. This was in 2009, as I say. In order to restore and correct intercellular signaling to consequently restore health. These concepts is the milestone of low-dose medicines. 5 years of clinical research and on and on. But this is being looked at 5 years, so this has already got 10 years plus of history behind it. So the big question is, can low-dose cytokines, hormones, growth factors, neuropeptides be effective in biological systems under the minimal pharmacological effective dose? Because we all know if you give a pharmacological dose, it has so many side effects, you can't use it. So these people have gone and said, right, how can we do it this way? And this is the blend. And now, with a change of just 2 words, 2 phrases, 2 interpretations, you can now get research published in pulmonary pharmacology saying we have, in theory, a cure for asthma. That's pretty bold. Journal of Cancer, Gastroenterology Research, all A1 medical journals publishing how these medicines work. But let's not get ahead of ourselves. How do we get there, and how can we use it in our everyday practices? So the path we'll take during this lecture, this is sort of mapped out, but one thing that those of us who know, inflammation is the mother of all diseases. Well, we heard that earlier on today. Drainage, the father of all therapies. And you know what? The guys who teach this from Italy say 50% of a good therapy is drainage. And we heard that in indirect methods from some of the other lecturers as well. So we're going to start with the scientific basis of physiological regulating medicine. And we're going to end up looking at triangles like this. And really, this is a system, and it's a combination of lectures that has evolved. And it's an Italian way of looking at things. With respect to the Italians, they just do things differently, and they do them away. So it's confusing to me, and I've gone through this like 100 times. I'll try and show you how they want to do it. But you have symptom treatment, and that's the symptoms you treat. Every treatment gets drainage and detoxification. Every treatment gets PNEI balancing, psychoneuroendocrinology, immunobalancing, because everything is out of balance, not one thing. Anyone know where this is? It's no, I think it's Istanbul. And this is a bridge going from Europe to Asia. And one of the best moments in my life, I took one of my sons to Istanbul. I said, where do you want to go for lunch? And he says, I want to go to Asia. And it's the only place in the world you can go down the road, get on a ferry, go to Asia, and then do something different. So he just thinks out the box. Well worth a visit. Absolutely phenomenal country. But this is the bridge connecting conventional wisdom to complementary and alternative medicine. And so we're all here or hereabouts. And let this bridge be that way to get over it. So, Guna method and its pharmacology. What Guna does is bring complementary and alternative medicine and conventional medicine. So, we're going to go a little review of homeopathic medicine with plants and minerals. But then, how many of you are funky enough to use neuropeptides and cytokines and hormones and growth factors in the same remedy? It's pretty phenomenal, but at biologically effective doses. So we have, and there's going to be a few terms from you, we use homeopathy, and some of the slides are repeated, and I'm sorry about that, but it's for effect. I want you to hear it again and again. So we're using homeopathy. Homotoxicology, whole new field in itself, and it's so exciting, and that's where a lot of us cut our teeth into modern homeopathy, is what we would call it. The use of catalysts and nosodes. PNEI, which is Guna, they bring in the hormones and the interleukins. And always, 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 there's nutrition. Without the nutrition there. And if you look at Hahnemann's work with homotoxicology, he always used nutrition. It seems to have been dropped a little bit. But nutrition underlies everything. And so I'm going to show you this as to where we're going to lead to at the end of the talk, where we have something called Guna Flam. Well, I'll sort of guess what it's for. It's for inflammation. So you're using homeopathic aconite, but you're using anti-interleukin-1 alpha. What the hell is that? You're using aconite. You're using pineal gland extract. You're using, I can't even say that word. Yeah, I can say conjunctive tissue, okay? And you're using melatonin. This is a real blend of medicines, but they're put together in such a way. And I might as well say it now, I'll say it again. But you can either go and listen to a single instrument. And I heard, there's a lady called Evelyn Glennie. Anyone know Evelyn Glennie? She's the world's first international percussionist. She's also deaf. So she actually plays in bare feet and feels the vibrations. Look outside the box. So it's either you hear someone just playing one instrument, or like yesterday, you hear a group of people playing together, and they bring so much more to the orchestra. So this is an orchestra, or a smorgasbord if you're looking at food, which I do like doing as well. So it's a smorgasbord of everything. But let's take a step back. And homeopathy, where they use plants, minerals, and animal principles, And they basically said you either give something similar to cause and effect or give something opposite to cause the effect. This is not a lecture on homeopathy. Now, the trouble is, everyone is so anti-homeopathics because they don't listen. So this sheeple, I'll read this for you. People who prefer a state of comfortable unconsciousness, regardless of their race, religion, nationality, culture, language, or economic status. People that are unaware of their own ignorance regarding the obvious. Homeopathy has worked for 200 years. As you saw, 8 million Italians use it, and yet we're still being told it doesn't work. How ignorant can you be? People are only concerned with events taking place within the application of their lives. We are so selfish these days. People who only value freedom when it benefits them. And we have people physically, or certainly on the internet, attacking those of us who use homeopathics. Not because they say it shouldn't work, they say it's dangerous. There's never been any evidence. So it's a shame, all these things. And, the bottom line is, and this is the main one, people who take more than they give. And that's what it is. But take it to the 21st century. This is what we want to do, and this is where most people are going and listening to what the media is saying. Okay. So the principles of homeopathy. Infinitesimal doses. It can't work because it's so dilute. Wrong. All you have to do is apply quantum physics. How many of you know about quantum physics or gone and looked? Those of us who wanted to have learned quantum physics. Similar and individuality. I will skip through these because I want to get to the meat of the lecture. And there's this thing called the law of Arndt-Schultz, where basically a weak stimulus activates a biological function. This is fact. This is science. This isn't me making it up. A medium stimulus modulates it. A strong stimulate inhibits it, and a very strong blocks it. What does that mean in real life? If you give aconitin to a heart at 10 to the minus 5, which we'll come on to what these figures mean in a minute, you'll have fibrillation. You'll have bradycardia. So one, the heart is going fast. The other one, the heart's going slow. At 10 to the minus 18, it doesn't have any effect on a healthy heart, but it normalizes the rhythm in a toxic heart. And that's not me. This is science, and this is from 1984. They don't address the science. They just say it doesn't work, it's not good. They knock the scientific principles. It works. If you give cortisone, 5 milligrams cortisone, you stop everything working. That's what we're designed to do in modern drugs. But if you give cortisone at 10 to the minus 6, it actually stimulates. This is the science behind what actually happens. And this is for all the students at the back. This is a useful one. If you take Nux Vom as a thing, a poison ivy, isn't it? Nux Vom? Yeah? It makes you produce loads of stomach acids and you feel really ill. If you go on a night on a bender and you take a homeopathic dose, you can drink more because it doesn't irritate your stomach. And those of us have done the experiments. And this is science. So if you have irritable stomach, and we saw earlier about someone talking about gastric reflux and stuff, Nux Vom is another way of dealing with the fact, as well as shining in the mouth to see whether they got the effects of GERD. This is the big problem with homeopathy. I'm here, okay? Because homeopathics say, you have to do it this way, only this, don't take any other remedies, don't mix remedies together. And the real pure homeopaths, sorry guys, can be a bit of a pain in the ass. Because homeopathy came, from Hahnemann, 1740, is it? Something like that. The world has moved on, and there's all the reasons why old homeopathy doesn't work in the modern world. But that's okay, because we got this thing called homotoxicology. And homotoxicology came out of Germany. What's in that water? It's really nice. Yes, it's really good. And homotoxicology is a super step forwards, and it's something that I and myself and Mike, you've heard him talk about injecting Traumeel, has come on for years and years and years. And basically, they look to have a functional recovery. So we come on to drainage. And we give catalysts. I'll show you what all these means. We give nosodes and then we give Swiss organ preparations. What does that mean in more detail? Well, here's your Krebs cycle, folks. And Krebs cycle is brilliant. If you guys want copies of this lecture, just give me a pen drive and I'll give you the whole lot, okay? Yeah, it's, you know, just there. You can take pictures of me. Oh, I forgot. Sorry. Yeah. Sorry, you got to do this. Thanks for reminding me. There you go. The ultimate selfie. All right. That's it. I'm happy now. Okay. So the Krebs cycle and quinones. Well, what the hell does this mean? Well, you know, this is pretty damn important because there's your Krebs cycle, and look at all the things that you need to keep the Krebs cycle going. And so homotoxicology, and this is in the 50s before real biochemistry and dissecting things down. Hahnemann, who was a German, came up with, you needed these to keep the Krebs cycle going. Well, is that important? Well, here's a real kick-ass slide. So if you have your Krebs cycle and it's going round and round and round, if it gets blocked and you only get to this, you'll end up with more stress. If it gets round to here and it gets blocked, you get more neuromuscular pathologies. If you get to here, you get aging, and so on and so on and so on. So let's go back. If you don't have all of these at the correct amounts, your Krebs cycle doesn't work, and you don't have as much energy, which is all our fibromyalgia people about, I don't have enough energy, because it got blocked by, and it was interesting, arsenic blocks one of these dead. That's why arsenic is good at killing you. It just blocks your Krebs cycle like that, and it doesn't work. Whereas mercury just takes a bit from here, a bit from there, a bit from here, a bit from here, a bit from here, and that's why it just sits on the system. And so that is one of the best slides I'll actually show you, because a lot of illness is due to toxification or poisoning of certain parts of your Krebs cycle, and then you'll get the illness. So, again, same thing in a different slide, but so, so good. And that's why I'll happily share all of these with you. The other thing that homotoxicology brought was nosodes, where you take pathologic material, and it's getting a bit tricky now with CJD and everything, where you take secretions or excretions or morbid tissues. And we were actually talking about excretions yesterday, weren't we, in breastfeeding and cows and dung and everything. And you take cultures. You then prepare it a certain way, and then you give it back. And all of a sudden, you're giving a small amount back to the body, and the body can deal with it in a small dose where it can't in a big dose. So the use of nosodes, albeit frightening, is quite cool. If we go on to swine tissue, or they call it Swiss organ preparations, they do take really healthy pigs, and they take out certain parts of the organs, and they prepare them homeopathically, and you give it back, and all of a sudden, the body gets a little bit of information back again. So I always look at homeopathy, or certainly homotoxicology, as the blueprints of a building. You still need the building blocks, the nutrition and other things, and you still need the emotions, which is probably the environment in which you're building, to be able to build it, but you need all of these. But this definitely give the body the blueprints back again. And just for an example, you give hypophysis suis as a D6, which is a certain dilution, and a D30, which is a lot more dilute. It stimulates part of your pituitary. The pituitary gland works better, and then you get follicular stimulating hormone. So you can give this for a variety of things, including you'll see THH go up, growth hormone go up. So one remedy given here has a knock-on effect throughout the body. The further downstream you go, and Mr. Singh, who was talking yesterday, saying go back to the cause rather than giving more thyroid hormone or more growth hormone. Why isn't this working in the first place? So that's where homotoxicology has come in. And again, this kind of thing, low potency stimulate, high potency slow down. What Hahnemann was able to do was to put the foot on the throttle so you can stay at 70 miles an hour. Not too fast, not too slow. He worked it out. And again, similar kind of slide saying the same things. So here's a break. Please do all of this. Okay, so let's just clear the brains again, all right? Because you can get lost in all this information. What does Guna say? First, We want everything to be synergistic. Secondly, we want to have completeness. We don't want to just fix one thing and leave something else out. And thirdly, everything is a balance. And that balance is good for this one moment in time. Because when I fly back to England tomorrow, I'm out of balance again. And the sooner I can get my balance back again, which means eating at English times tomorrow, which means trying to sleep at English times tomorrow, will mean I'll gain my balance back sooner. That's why I wasn't in the bar last night partying, though it was officially heard no one was partying last night. So we want things to work together. So this is just what I've said. The second principle, and these are Italian words, okay? So the etiopathologenic process of the pathology being treated is inscribed with homeopharmacological structures of the Guna method. What does that mean? Okay? It just means, for example, if you have an allergen, it sensitizes the tissue. What that does is it alters your immune system between a Th1 and a Th2 balance. And I'm going to be going on a lot about balance. If this goes wrong, you get degranulation, you get liberation of allergies, and then you get all this watery eyes, itching, sneezing, nasal congestion. Do we treat down here, or do we treat up here? Because this might be unavoidable. And I would suggest to you, if we treat here, which is what Guna method is, then you'll find you can deal with all of those. And it was interesting, there are slides about breathing. I have in the UK lectured on the importance of vitamin O, oxygen, and breathing and not snoring. It's very synonymous, and it ties in with what Dr. Singh and Martha are saying. So it's just, how big are your arms to encompass and love all of this? So here's Guna Prev, Guna allergy prevention, okay? And here, in one remedy again, you've got citric acid cycle, trying to get that working. You've got classic homeopathics, sulfur. You've got histamine. Well, that's quite novel to actually give histamine as a homeopathic dose to try and control the flush of histamine that you have in the system. Here's some classic homeopathics to try and desensitize. That's like vaccination and homeopathics coming together. And here's some things, and I'm not a great homeopath, I don't understand, but here we go, interleukin 12, in the same one as homeopathics. So by combining everything together, you get that synergy. You're dealing with it at so many different levels. So when it comes to PRM, which is physiological regulating medicine, and I'll tell you why I'm belaboring the point, because you can talk about homeopathy, people close down. You can talk about modern homeopathy, people close down. You talk about physiological regulating medicine, it's, what's that? That sounds good. We are regulating the piece, we are regulating someone's physiology. We want to just get back to balance rather than suppressing it more and more. And hopefully I can illustrate it. So we use all of these and all of these. And this is the slide that I like again because we use psychoneuroendocrine immunology, molecular biology, and it's quite exciting. It's an only overview today. Don't hit me because I don't know all the details. Nutrition, absolutely important. Homeopathy, bring it as an adjunct. It helps. Homotoxicology, and this is the nice thing, quantum physics. I'm actually going to talk a bit about quantum physics. I'm pretty happy. I've got some friends who are brilliant on quantum physics, but we'll go further into the lecture. So again, we've seen this slide before. So their definition of physiological regulating medicine is an innovative therapeutic system based on the possibility to use low doses of biological substances, including signaling molecules, that normally lead to the physiology of the human organism. You're trying to regain balance. And they have lots of ways of illustrating things. Here you have the main ones they use, which is low-dose cytokines, neuropeptides, low-dose hormones, growth factors, and then use this bioregulatory skin physiology. I look at that really as within the body. And this is, you know, I showed you that bit where it says detox and drainage. You've got to drain the system as well. And then you use these to try and get this into balance again. And what we're basically saying is you're going to use a fine control of low-dose messenger molecules acting on membrane receptors. And again, if you had the full 2 days, there's a whole lecture on membrane receptors and getting good fatty acids, so you've got that flexibility of the cell membrane. So you've got receptors and molecules, and these things move around. It's absolutely fascinating. But you're getting a brief overview, and if anyone wants to bring Guna over proper, then they can give you some more talks. So you're going to see this again and again. Now, we've had this from several other lecturers as well, where if you have homeostasis, and again, this has been talked about, Dr. Singh was talking about the homeostasis of breathing, and if we don't have homeostasis, then you get changes. But homeostasis controlled by temperature, pH, oxygen, it's right there, and blood sugar level control. If it goes too low or too high, we have disease. I think we're all acknowledging that. And the one thing that they're having a hard time grasping, and certainly in the UK this is a big thing, even if a localized specific organ or tissue or disease, it expresses throughout the whole of the body. We saw the previous gentleman talk about gum disease having a whole total effect on C-reactive protein. This is something that I produced for my practice, and it says gum disease can cause heart disease, high blood pressure, and stroke. Gum disease and tooth loss increases the risk of Alzheimer's. So I sent this to all the people dealing with heart problems in every medical practice, all the diabetics in every medical practice, all the stroke medication people. No one came. No one came to listen to how gum disease can affect. And yet the science says that gum disease increases C-reactive protein, a whole body effect, and we can get in there and deal with it. And I'll come to what Guna remedies we have to help gum disease, but it's still no substitute for getting in and getting things clean and water flossers and picks and all of that kind of stuff. So here's an example. Osteoporosis. I'm sorry, these slides are a bit slow. So low levels of estrogens, that's right for you guys. Is that the right spelling for you? There should be an O on it for me. That increases parathyroid gland, which then increases PTH, parathyroid hormone, which alters your calcium, magnesium, and phosphate levels, which in turn creates acidosis. See, I've read this more than once. Acidosis then causes decrease in homeostatic control of calcium, and we heard about calcium before. But acidosis also increases tumor necrosis alpha, interleukin-6, which then affects osteoclasts and osteoblasts. Now, the way we deal with it in modern medicine is you then give bisphosphonates here to regulate this. That's what we do. And you heard Mike talk about bisphosphonates and what you're going to do with patients, and this is an ever-growing problem. If we look at this and we give, for menopause problems, and this is where we're seeing all the problems, some of the Guna remedies, osteobios, and I'll show you what's in osteobios in a minute, along with Guna matrix, and this to me is the most important. 50% of this treatment will work because you drain the matrix, you then realkalize people, and then rebalance the hormones. That's how it works. But what's in osteobios? Osteobios has parathyroid gland, and this, as you can see, is in a 10, a 30, and a 200x. That's what homotoxicology calls a homochord. So instead of playing the middle note C, you play a low C and a high C. So you give it the whole range of vibrations that can get in and affect. You give calcitonin, oops, bit of a giveaway. You give calcitonin as a 6x. So that limits bone resorption and reduces the level of parathyroid hormone. So you're giving an opposite hormone. Instead of parathyroid hormone going up, you give another one to balance the whole thing. So you get balance. And what happens is calcium is kept inside the bone, and you improve the structure of the bone. So instead of giving bisphosphonates, and now I'm getting outside my range of comfort, you should be perhaps doing this kind of therapy. If someone's worried, if someone wants implants, maybe you should be giving this rather than bisphosphonates and you ruin the rest of their life. Time to breathe again. That's the use of the English language. All right? So, same picture again. So PNEI is saying we have a crosstalk due to an unbalanced signaling between these molecules. So again, let's have a look at some examples. 10 to the minus 6, hyperconcentration, 10 to the minus 15 below. And the next slide defines these things. And it doesn't matter how many times I look at them, I can never remember. But picograms, 10 to the minus 12, femtograms, 10 to the minus 15. This is the kind of range that we try and work within. The problem is, by a pharmacological point of view, in which concentration to use the signaling molecules. Now, a problem only becomes a problem when we choose to see it. So, I've had lots of problems, and you just get around it, don't you? Or if you say there's a problem, I'm not going to go anywhere. But then, how many people have had Jack Sparrow? The problem is not the problem is your attitude to the problem. And that really is true. So if I ever get the chance to lecture again, I've got quotes from Yoda and everyone. So I think it'll be, films can teach us a lot. So this is the problem with cytokines. And they have been looked at. How many people remember MS treatments and you wanting to give, what were they trying to give for MS people? Interleukins, weren't they? But they were too toxic to give to control the inflammation. Because over 10 to the minus 3, too toxic, and there's toxic effects. If you give it in a therapeutic dose, you will get some benefit, but you'll still get side effects. At 10 to the minus 5, you'll get minimal pharmacological doses. If we go below this, 10 to the minus 6 to 10 to the minus 12, if you give it without SKA, and I'll come on to that in a minute, you won't see any therapeutic effect. If you give it with SK effect, you get therapy. So, what is SKA? So how low must a dose be to be effective and safe? And that's the thing is, if we go back a slide, you can give cytokines at this level, but you're going to have side effects. You give them at this, and they don't work unless we SKA it. So, concentration of guna, sequential kinetic activation. How many of you know what sequential kinetic activation is? Any of you using homeopathy know what it is, because it's succussion. But if you write in a medical journal, we succuss the remedy, you don't get published. So you change succussion to sequential kinetic activation, you dilute it and then bang it a bit, then all of a sudden you can get published. So you can go down to picograms is 10 to the minus 12, so that's down to 10 to the minus 14, and if you bang it, and believe me, the Italians have banged it this way, banged it that way, Hahnemann used to bang it on a Bible. But the bottom line is, SKA is the new word for succussion. Simple as that, and it gets round all the publications. And I also took great pride once in lecturing this to a homeopathic group in the UK. And what's your organ of succussion? You are producing hormones all the time. And what's the difference between a hormone, testosterone, or estrogen, or interleukin 5, or whatever? What's the difference between that and a pharmacological interleukin 5 that you give in? It's because every time you're alive, your heart is succussing, and it's telling you that's what is giving you that life force. Now, at that point, the homeopath stood up and walked away. But think about it. What makes it real for you is your heart succussing these things. It's just a great way. So low doses succussed by your heart gives you that life force. And this is interesting, and I'm just going to digress a little bit. Okay. Only physiological concentrations are able to activate or reactivate membrane receptors and stimulate the physiological function of a cell. So let's go about diabetes for a minute, because it's a big thing. And I might be wrong on this, but this is how I see it in my brain. I'm a simple man. You have a bit of sugar, you put a bit of insulin out, and it says, hey cells, pick up the sugar, and the cells pick the sugar up. So then you have a can of Coke, which is, Majid Ali had a brilliant thing on how much Coke goes into a child. I'll see if I can find it to you. But you take more and more sugar. So what does the body do? Produce more insulin, saying, come on guys, take a bit more up. The cells say, okay, I'll take a bit more up. I'll take a bit more up. And then all of a sudden, you're taking too much sugar. So what do? You start to give them more and more insulin. So you're shouting at them, saying, please take it in. Well, they only work at a certain dose. And the more you shout at them, the less they work. And so we end up with sugar floating around in our blood, and the sugar then sticks to everything. It caramelizes and then sticks to nerves, sticks to optic nerves, sticks to everything. And that's why sugar kills us, because we're shouting, but they can't hear us because we're shouting too loud. So let me show you what that means. The affinity for a receptor for a specific cytokine, the right cytokine or specific hormone is very high. So you have this dissociation. So if you got the dilution of 10 to the minus 9 to 10 to the minus 12, it will work. And what we've done in modern medicine is we think, well, if we shout louder, it'll work. And it really doesn't happen that way. But what you've got to do is to get the message through. So Guna have come up with things like potentized or sequential kinetic activation insulin that is only at 10 to the minus 9, but it has the right message. Instead of it saying, oh, shut up, I can't take any more, it just whispers to them, come on, guys, help us out of here. Make sense? So this is what I'm saying, really. It's not only the right message, but the right volume. And so by shouting at someone, does it really work? Or you just go back and give the message. Now, this isn't the only thing. We've got to deal with the sugars and everything, but there you go. So it is a smart drug delivery system. And, you know, how many people talk about smart this, smart that, smart the other? We've got smartphones on us. Able to deliver an effective molecular concentrations below the minimal effective dose if you look at modern medicines. And I'll come back to this. I'll show you some studies where it actually works. This is really exciting, and there's some brilliant books, but we all know the work by Emoto, the Japanese guy who looked at water and you crystallize. So this is what we're getting into. The capacity of basic substances to release the water, and we saw a person that you have a low dose of a medicine. How can it affect so many cells? And very simply, if you get one molecule here, and then it spins, all this water takes the information. So it's like a ripple in the sea. One drop, and it spreads throughout, because what sequential kinetic activation does is, it lines up all the water molecules. And this is basically what that's saying in Italian. I did cut and paste it and do it in Google Translate. But it's basically, if you line up the water molecules and make it biological water, then the information can go much further than just one molecule trying to get every single cell. So biological water, clean water, pure water, water that, dare I say, you pray over or you say thank you to, gives this life energy. And so we're not afraid, but this is quantum physics. Go away and read it. People who don't believe it, and I have a son who's a PhD researcher. He says this doesn't work on water. But the science is there. The books are all there. There's so much out there saying this is how it works. So, people hate the truth. That is the truth. But they don't want to read it. And it's lucky that the truth doesn't hurt. And you know what this man said? Everything is vibration. And it is. Go before that, we're all condensed light. But that's another lecture. But if you believe the world is like that, then it alters everything. Homeopathics has always talked about vibration. We can prove it with quantum physics. So let's get back to PRM. Here we have philosophies: symptom treatment, drainage and detoxification, and PNI rebalancing. So let's just go over some symptom changes first. So here's a question. Is it possible to modulate the action of cytokines and other signaling molecules? Well, you heard the gentleman this morning talk about inflammation and how damaging and harmful it is. And one way of getting rid of inflammation is to use antioxidants and reduce the oxidative stress. But let's have another look at doing it. I'm not diminishing that, but we have a problem. How do we deal with it? How do you use messenger molecules of scales of the body? Now, I'm going to have to just explain this a little bit. What you do is you have, and this is way out my league, okay? You have cells, and then they become either Th1, Th2, or Th17. And this is an ever-evolving field as we look at more and more immune system functions. Don't ask me to explain it in detail because I don't know. But if you have Th1, you're going to have immunopathology and organ-specific autoimmunity. If you have Th2, you're going to have allergies. But Th1 is also inflammation. So, and Th17, if it's on his side, you'll get some illnesses. If it's on his side, you'll get some illnesses. Let me illustrate. There's the immune system. Now, this is the Italian way of looking at balance. So if you have an imbalance, to them, things go up. Took me a long time to work this out, okay? If I could have the time to redesign these slides, and I'll have a word with them. So here, Th1 is upregulated. You have more Th1, Th17, and you will see Crohn's disease, vitiligo. If, or possibly, Th2 is low. You don't know. Here, Th1 is down, but Th2 is up. And here, you'll have asthma and other illnesses and autoimmune diseases. So you've just got to look at it, and bear with me, because I still have to look at it every time I read through these slides, but these are the slides I was given. So in an allergy, you have an increase of these interleukins, or possibly lowered Th1. Or you have Th1 interleukins and cytokines down. So here's all the ones that we're going to talk about for a few minutes. Interleukin 1, tumor necrosis factor, interleukin 6 and 8. But what we're going to try and show you is that these are the anti-inflammatory cytokines. How do we use those? So let's grow and develop. The concept of balance rather than suppression. Antagonistic cytokines are utilized to put a brake on the biological effect. So you're using the same cytokines sometimes to enhance. So do you bring one up, or do you bring the other one down? It's a matter of balance. Which part of the scales do you put less in here, or do you put more in here? But remember, the scales are working upside down. This is where it just messes with your mind a little bit. This is what happens in your body. If you have a lot of interleukin 4, it makes more Th2 and makes the allergy worse. It also, at the same time, downregulates interleukin 12 and something that's INF gamma. But INF gamma, if you have an inflammatory disease, downregulates Th2. So this is the body's way of saying, we've got an inflammation, let's turn this bit off and put all our soldiers over here. Or the other way around, we've got allergy problems. Let's turn off the soldiers for a minute, let's concentrate on this. But what happens these days is the balance doesn't stay, it doesn't equilibrate. Let me show you how this works. And, just some science. This is 1997, that if you give interleukin 4 at a picogram, 10 to the minus 12, it inhibits the opposite side. This is just, there's so much science behind this. So here we have inflammation, and here we have immune decline. Again, it'll all be explained as we go through. So when we have inflammation, all these cytokines go up, all these go down. When we have hypo problems, these cytokines go down, it's just visual again. More specific, and we talked about the secret killer, inflammation. So let's talk about inflammation first of all. What do all these conditions have in common? Again, I couldn't get the animation off this, so just talk amongst yourselves for a few minutes. Oh, thank you, Mike. And, hey, the most important one. So credit to the Italians, they actually put dentistry in as a big cause of inflammation. So what we have is an increase of Th1, Th17, because it's batting for the Th1 side, and Th2, the regulation is down. So we'll skip that one. So what happens when we have inflammation? You get an immediate increase of interleukin-17, interleukin-1, tumor necrosis factor, and interleukin-6. And this is a time scale. I'll show you a time scale in just a minute. So what normally happens is that you get inflammation with an increase of Th1, and then after a set period of time, I think it's 72 to 96 hours, this comes down, and that goes up, and we get our balance back again, back into homeostasis. That's how we would like the body to work. But in acute inflammation, we get too much interleukin-1, and it creates all of these things, COX-2, prostaglandins, and nitric oxide. So at 5 o'clock this morning, I was actually trying to remember what nitric oxide and everything was. But put it this way, conventional drugs to stop the effects. So you've got non-steroidal anti-inflammatories, paracetamols, Nurofens, cortisone, aspirin. So you're taking all of these to stop interleukin-1. What Guna and Guna method, or PRM, does is if you give an anti-interleukin-1 at a 4CH, that's actually 10 to the minus 12, as a physiological dilution, diluted and sequentially kinetically activated, then all of a sudden it blocks interleukin-1. So it blocks all of these processes. And to put it graphically, you give that and you just stop this, so you stop all of this. So you stop that dependence on all of these anti-inflammatories and cortisones. Now, you should not stop inflammation. And those of us who have used homotoxicology for many, many years will use Traumeel. It doesn't stop inflammation. You shouldn't stop inflammation. What you should do is modulate the effect. There's a guy called Bruno Brand who wrote a great book out of Belgium talking about why inflammation is needed. The problem is you need inflammation in a measured approach. And what we're talking about is interleukin goes crazy, and all of a sudden we're then suppressing it rather than modulating it. What happens if interleukin-6 goes out of hand? It goes up and normally comes down again as interleukin-10 comes up and sort of balances the whole thing back. This is a few hours, this is towards the 96 hours plus. But what happens if interleukin-6 goes up and stays? We then get chronic inflammation. But if by giving interleukin-10, sorry, let's just go back a slide, this is what we don't want. This is chronic inflammation. And so people are taking painkillers and drugs all the time. Whereas if you give interleukin-10, all of a sudden it comes, brings interleukin-6 down again. You have to keep it high for a while, and it stops that interleukin-6 from going high again. So we know using low-dose, sequentially kinetically activated interleukin, in low-grade chronic inflammation, which is what we were talking about, interleukin-10 downregulates. It brings down inflammation naturally by restoring balance. Okay, and they're giving interleukin-10 at a 4CH, 10 to the minus 12. And we're creeping in Gunaflam. So you have anti-inflammatory cytokines and inflammation cytokines. I'm just checking where I am on time-wise. Okay, I'm going to skip through a few. This is an important one, though. Anti-IL-1 decreases acute inflammation. This reduces chronic inflammation. This balances autoimmune diseases. This balances and creates healing. Got through that bit. Okay? But there's more, because we've only been talking about inflammation and interleukins. And this is something that you can start to go home once we can find where you can buy it from and you can start to use. Gunaflam. And it's got what you need in it. It's got anti-IL-1, tumor growth factor, interleukin-10. So this is taking down on a cytokine level the inflammation. But you're also using homeopathics to help heal as well. So you're having an anti-inflammatory action, you're having a pain-killing action using beta endorphins while it beats taking heroin or cocaine or something like that. You've got your natural homeopathic remedies, Hep-Self, we've used in homeopathics for years and years. And then what you're trying to do is to balance the person again, give them melatonin, get their circadian rhythms going again. Because if you're wired all the time, you're not going to heal as well. We all know that. So, Guna Flam, and this isn't an advert from me, this is an advert from the company, will help pain from inflammation after dental extractions. But it'll also help with colitis because it's inflammation is inflammation is inflammation. And this is how we'd use it. It's all in your notes. The other nice thing to use is Guna Trauma. So if you're going to have a problem, then you can almost give it before. So you're preparing the body with arnica, with anti-interleukin 4. So you're already looking to try and get the body balanced. And then you're saying, we're going to do injury. What can we give the body so it's ready to start to repair itself, rather than let the injury and hope the body. So you're just preparing it. So again, a little bit of humor. So it's not the right use of coconuts. So the other thing is, if we have chronic inflammation in certain diseases, is it an autoimmune disease or is it an inflammatory disease? And this is where TH17, depending on which side it bats for, will have different things. But now, can you see, if you give just a general non-steroidal anti-inflammatory, you don't know which side of the inflammation you want to treat. Now you have a better idea of what you would use if TH1 is high. You're going to use what I've just shown you, interleukin 10, anti-interleukin to reduce the TH1. You need to go and look at the notes. It's taken me a long time to get this in my head. I'm just going to go. So anti-leukin and interleukin 10 are modern, effective, no side effects instead of your non-steroidal anti-inflammatories and your cortisone, and it works. So we'll skip through these because these are therapies you would give for bowels and Crohn's disease. Interestingly, you can give this, you know, they come with so many different remedies and therapies, and I want to get on to the dentistry. But as someone gets older, they've recognized you can give, and this is homotoxicology, cerebrum compositum, brain homeopathics to boost their mental capacity. Drainage, because as we get older, and I'll come to drainage because I love drainage, you drain out the body, flush the body clean, all of a sudden it's going to work better. All your molecules that are moving through, if the body's clogged up, then the molecules aren't going to get to where they need to be. And you balance the hormones and you reduce the inflammation, which we heard again, there is so much inflammation in the older people. Again, another way of beautifully putting it, I put that in this morning because I thought it was exciting. But we're going to get to Guna Matrix. The biggest thing in this room is the air. If the air was poisoned, you're all individual cells. If the air is poisoned, all the cells are going to... Okay, so what's the most important thing? Secondly, is the temperature. It's getting incredibly hot with this jacket on standing up here. But all these things you can't see, but are there. And what Guna Matrix does, and a couple of the other remedies, is it actually looks to regulate the air in this room, the temperature in this room, how the air flows in and out. It's no good if you've got a little hole in and a little hole out. So it regulates things. So here you have classic homotoxicology, support the metabolism. You know that Krebs cycle I showed you before? This is making sure you've got enough energy for everything to work. You need energy for your lymphatics to work. You need DHA and other hormones because your matrix every day becomes acid and alkaline. It becomes liquid and solid. It breaks down and it builds up. We don't acknowledge this when we do modern medicine. We just think, oh, it'll heal. There are certain times you take remedies. Homotoxicology was brilliant because you took remedies at certain times of the day depending on what biological function. And certainly when we were at Capitol, they were talking about giving us nutrition at certain times of the day because that's when the body needed it. So we're bringing all of these factors in. Lymphatic tissue to remind the body how to work. So we've got Guna matrix. And the thing is, if you're not well, if you're not breathing well, it doesn't matter how good the air is, you want to breathe well as well, so you can actually get the cells working better as well. If your whole immune system is down, you're always getting colds, you're always getting this, this is a remedy that boosts up both Th1 and Th2. But we've only talked about the immune side of it. Let's talk about the endocrine system. Very simply, if your endocrines and your hormones are out, be it a male or a female, then we need to get everything balanced. So, very simply, they have Guna male, Guna female. And it has everything in to rebalance, including getting the thyroid balance, which is what the previous lecture was talking about. Get the thymus gland to improve your immune system. Get your adrenals working. A little bit of adrenal gland at the right concentration gives a stimulus to the body and say, hey, adrenals, we know you're under stress. Here's that blueprint of how to rebuild again. Get your pancreas so your insulin is right. So it's given a whole thing. You're not giving estrogen or progesterone or just TSH or T4. You're giving everything and nudging all of them. Let's get back into balance again. And you got one for us blokes as well. But how much of our illness is controlled by our mind and our rhythms and how we think? So we also add in Guna mood, so it gets your thymus gland working better. It's giving things to balance your mood with serotonin. So instead of giving more serotonin uptake inhibitors or whatever we want to do to try and get the mind right, just balance the serotonin levels. You know when you see a picture of a neuron, and you have the neuron and you have the space and the two neurons, and you've got this gap in between, and you get the acetylcholine that goes from one side to the other. What does that travel through? It travels through the matrix. If your matrix is clogged, and we're going to come to that in a minute, you don't get them. So instead of putting more and more and more serotonin in, or the serotonin that does get across, you say, well, we don't want you to take it up, we'll keep it there so you work. Clean the matrix, and just as this is doing, sensitizing the body again with the right message that the body recommends, rather than shouting at it and giving it more and more and more. That's how it works. And lots of other remedies. We're going to skip through some of these, but we're going to come to drainage and detoxification. And those of you who know homotoxicology, this is where it all came from. How to get the things between everything else clean and healthy and working. How do you get the air fresh? And if you can drain the matrix to a level, you reduce inflammation. So there's other ways of looking at inflammation. You can balance cytokines, just get the matrix clean, just get the air clean. So, I'll come back to IKEA in a minute, okay? But just look at that. It's true, isn't it? Yeah? And here's a question for you, okay? What's here? People, but it's what you want, and I'm going to tell you what you want in a minute. Because I bet you every time you go to IKEA, you buy this. Okay? Pardon? Meatballs. No, it's not. No, meatballs is at the restaurant here. So you've gone through all the stuff you don't want to see. Kids are screaming for meatballs and stuff. And then you walk through the other things that, you hear and you say, oh, that's a good idea. You don't need it. You buy it, you put it in the back of a drawer, and you find it 5 years later, don't you? But, that's what this is all designed for. So, Guna Matrix. And 50% of any therapy you do on someone is to drain the toxins out. If you give antibiotics to kill bacteria here, what do you then do with it? You just kill the bugs there and leave all the dead bodies here. We hear of the Herxheimer reaction. You kill the bugs, you kill the candida in your gut, and they're just there. Don't you want to get rid of them? And that's what Guna Matrix does. It stimulates everything to get rid of, it gets the lymphatics working, make sure you poo twice a day, we heard that before, make sure your liver's working, make sure you're peeing enough and drinking enough water. This is nothing new, it's just putting it together in a system. And so, homotoxicology, and I'm going to digress just a little bit, has 6 stages of being ill. And let me explain. Inflammation and hyper-response. So all of us get junk mail, don't we? Not talking about email now, I'm talking about the old-fashioned mail. So you get junk mail. And what do you do with it? Well, you either throw it out, and your bin gets full, and that is your runny nose, your diarrhea, your sweating. You get rid of it. But if you can't get rid of it, you have a little fire, don't you? So your inflammation goes up. You try and burn off the toxins. But we live in a smokeless zone. I'm not allowed to have fires anymore. I can't throw it out because I don't want, you take your anti-diarrhea tablets, your anti-sneeze tablets and everything, so you're not getting rid of it. So I have more and more junk mail coming in. And so what do? I put it on top of the table, don't I? And you have, who's got a desk with piles of mail they're going to use? Yeah, we all have. So you have piles and piles and piles of paper. And homotoxicology splits it into two. One is extracellular. It's outside. You can see it. But you know what? The mother-in-law is going to come and visit. So what do you do with it? Seriously. You put it in the drawer, don't you? So all of a sudden, you put it in the cells. So all of a sudden, your cutlery drawer is full of all your junk mail. Yeah? Is that right? So then, what happens is, you then put it here. What happens is, as you get more and more junk mail, it goes in all the drawers. So the drawers don't work. So what do? You go to IKEA to buy more boxes, don't you? And that's what cancer is. You just produce more and more cells to do the job because this is intoxicated. But how do you get rid of this? Well, you can't because the matrix is full, because you can't burn it and you can't sweat it and poo it out. So whole thing about detox is if you get rid of it here, then you can enter it here, then you can do from the cell into the extracellular matrix, and then you can get rid of it. That is why we all become ill, because we store all the junk mail. Think about that letting go, which I said right at the beginning. Okay? It really is. Now, if you're going to try and get rid of it, do you get the lymphatics working? Do you get the matrix working? But if it's stuck in the cell, you've actually got to get the cells working again. And you've got to get rid of it. So unless you're pooing, unless your kidneys are working, and unless your liver's working, so it isn't a one remedy fits all, but that's 50% of getting your patient better. That's right. And so here are your homeopathics to get the lymphatics working. And again, a combination. And can you see how they're put them together? Reactivate your lymphatics. Stop the hypertrophy. And it's interesting what the guy was saying about your tonsils being high. Be interesting to give, because there's tonsillar compositum. I don't know whether it's in any of these. But you can give tonsils as a homeopathic or a homotoxicological preparation to see if you can get the tonsils to work together. I'm not saying you should do it instead of having your tonsils taken out, but it's a different therapeutic process. Get the cells working. Get all that stuff out your drawers, but it's got to come out the drawers onto your work surface. If your work surface isn't clean, it's not going to go anywhere. Get the liver working, because, 80% of your toxins come out your liver? If the liver's not working, it's not going to happen. Guna bowel. Make sure you're pooing twice a day. And, I have a dental practice with colonics in. 15 minutes, okay? And, keep on peeing. How long is it going to take? It's going to take some time. This is the other thing we're not good at. So when you see how long you take the remedies for, 45 days just to start to get things going, and maybe 90 days. You're talking 3-4 months of flushing the whole thing. I'm 56. Glad everyone agrees with me. How much toxins have I got in my system? I'm not going to, and eventually my cells fill up and they don't work anymore. How long is it going to take to clean my matrix, to then empty the cell into the matrix and out? It takes time, but the rewards are absolutely brilliant. But really, until the symptoms disappear. And you've got to be like that. When am I going to get better, Doc? Well, how long have you been going ill for? And let's just halve it, quarter it, eighth it. We don't know. Easiest perhaps in inflammatory diseases, acute inflammation rather than low-grade chronic inflammation. Can you see how the model's sort of fitting together? So here's some protocols that'll be in your handouts, or I'll quite happily give you all the slides afterwards. In allergic diseases, I'm going to skip through this because I want to get to dentistry. But this is some interesting slides. Let's go over this. This is where You get interleukin 10, which is on your inflammation side, so you get more secretory cells and IgG. So they did, I'll show you a quick experiment that they did. Low-dose administration of cytokines for the treatment of allergic asthma. Told you. So basically, they make poor little mice very allergic to things, and they give them something that they'll have a reaction to. And basically, these columns are saying, that's a healthy mouse, that's levels of interleukin-4 in an unhealthy mouse. This, number 3, is interleukin-4 in pharmacological concentrations, but we know that's going to be toxic. We know it's going to harm the mouse. This is physiological concentrations diluted and dynamized. And this is diluted but not dynamized. So can you see the SKA, and this slide was produced before SKA, you're getting the same as the pharmacological dose, but you don't have the side effects. That's the beauty, and there's loads and loads of research on this, but you're going to want to have to, you know, there's more and more to tell. And, you know, the same slide saying a slightly different thing. Levels of interleukin-12 and whatever that is. Just ever so quickly, because I'm so interested in airways. If you have increase in tonsils or you can't breathe through the nose, is it a Th1 response or is it a Th2 response? We tend to give the same remedy whether it's inflammation or whether it's an allergy. So you've got to look and say, if it's inflammation or if it's hypertrophy due to something else, you give different remedies. It's just, if someone's got a blocked nose, we don't just give them our remedy. You actually say, why have we got the blocked nose? And you give remedies to suit the blocked nose, not just the generic, I don't know what you give for a blocked nose, because I don't use medication. Pardon? Kleenex, yeah. Oh, that's a bad joke. I'm not going to go there. So here's something. So if you've got sinusitis, is it allergic or is it infective? You would give different interleukins depending on where the primary chronic sinusitis has come from. Right. Just some things before dentistry. Here you have a problem. Yeah. And so this is a word of warning. Don't go for it straight away, because you can see what's happened, can't you? So you know what's going to happen, don't you? Okay? And here we go. So what do you do? Okay? So, sometimes you need a bit of help, and I'm sure once you get to know Guna, they'll help you, or you find people to help you. But, again, if you give me a few minutes to organize, there are some absolutely brilliant books, or you go online, and you can download all the books that will give you all these prescriptions. It isn't hotel cookbook prescriptions, because you can see how they've thought it together, but you don't have to understand every interleukin and what it does. Dentistry. Okay, and I have 10 minutes left. Whoa! So these are some of the remedies I use literally every day. Dentatox number 8. I would just call it number 8. And I go through 2 or 3 of these a day. Someone comes in with a big fat face, and we won't go on to the holistic, what to do with root canals and this, that, and the other. You want to get rid of the pain straight away. So I have to give them antibiotics. I do. Yeah, it might be branded differently. They put different brand names on them, and they did take some of the dental ones out. But I'm sure number 8, or you can work it a different way. So yeah, I do work in Europe, and I just give this. I give them antibiotics, and I give them Guna number 8. And if they don't have a big problem, I'll say try this first. And if it doesn't work, here's the antibiotics as well. Antibiotics plus probiotics. Is that being holistic, or is that just being common and normal? Oh, sorry. And this is just classic homeopathics. But instead of the homeopathic saying, just giving silica, but be careful, it might kick your implants out, or just giving Hepar sulf to get rid of the pus, you're giving everything. You've got a whole damn orchestra going on here to help in all aspects, including drainage. Because if you want this to go, you've got to open up the lymphatics and make sure you go it. Or you just move it and put it somewhere else. And so what your man's talking about, and I totally believe in him, you've got toxins If you can't get them out your system, they come out your tooth, where are they going to go? Rather than, you've got toxins, maybe let's get rid of them. And I'm not saying you should keep root canals and just take these remedies, but it is a way of perhaps helping someone get through until the time is right to take the teeth out. I have patients on this, literally, they just take it a couple of times a week, and if they know they run out because the face starts coming up again. It's not an ideal way to treat, but it's their choice. They don't want the root canal out. They want to wait until it's their own time. But it is absolutely fabulous. And that is classic homeopathy. Blended together, homotoxicology, but it has to go with other things, which you'll see. Dentatox number 9, absolutely brilliant for gums. I'm not saying don't do all your gum therapy, but with this, people heal. You know, and, you know, it's got echinacea in, almost as a mother tincture. This is almost herbal medicine. This D4 is diluted 4 times. D1 is just diluted 1 in 10. This is neat, literally neat, and it works. Here's where we start saying, well, what more would you do? Well, if you're going to do proper hygiene, you want to give guna trauma. We've gone through guna trauma. We're going to give interleukin-6, which will stimulate bone. We can give MARDE and collagen. And here's something that I'm not going to touch, but I'm just going to mention. Everyone's doing cosmetics, aren't they? You know, Botox here, there, and everywhere, fillers. These guys have injectable homeopathics, or MARDE, so it will increase the drainage at the bottom of all these wrinkles that you have. It flows, and all of a sudden, it isn't a one fixed Botox, but you will see youthful, regenerated faces using natural remedies. It is a homeopathic Botox, for want of a better phrase, and it's MARDE. It's called MARDE, but if you have MARDE, M-A-D-E, and collagen as an injectable, and in the UK and certainly in Italy now, I've done the courses in Milan, they just stick needles in all the acupuncture points, the same as you do. Can I take the question at the end? Yeah. And, you know, Shabir and I, we went to see this lady, and she only injected half your face. Couldn't believe how good half your face is when you drain the matrix. And that's a whole range that we're not even talking about. I don't know whether it falls under biological dentistry. But people want to look good, and I'm sure a lot of you guys do cosmetic dentistry. What's wrong with using MARDE and Guna products to improve? You can actually use Heal products as well with this as well. So, Dentatox number 8 to get rid of the inflammation, Guna trauma, get the bone working. Can you see how it all works synergistically? Yes, now we're starting to use 5 or 6 different remedies for 2 to 3 months, but you're stimulating the body to heal naturally. So here we are, we're injecting MARDE and collagen, D6, to stimulate the body to remind itself how to heal. There are ones you can give before surgery. I'm determined to finish on time. There's a whole load of injectables to deal with facial pain and pain in your shoulders. So I'm thinking of doing some courses to get myself certificated in injecting things, but actually use these remedies because they are absolutely brilliant. Absolutely brilliant. But I'm too busy being a dentist to do them all at the moment. When you have acute abscesses, there's Dentatox number 8. There's Guna Flam. You can have other things on as well. These are more homotoxicology agents. These is, you know, Pyrangium ingele is literally something made from pus, made homeopathic, and then injected back in. I'll tell you one thing, and I know Mike and Shabir were talking about oral acupuncture. If you want a really frightening remedy, do anybody of you inject Traumeal in after extractions? Yeah? I'll tell you a really good trick. Just stick the needle in, and it'll bleed. Pull a little bit of blood out, and then succuss it or kinetically activate it. So you've got the smallest amount of their blood diluted and injected back in again. And that is called autosanguous therapy, where you draw up some of them and put it back in again. Just be aware. Or, if you've got a trigger point and you're unsure what to do, stick a needle in, or give them some anesthetic first, because, yeah, it does hurt. With a little bit of the blood, pull it back. So if you've got, you know, an upper 6 that you're relating to a shoulder or a knee problem, autosanguous it. Draw their blood, succuss it, put it back in again. it can be incredibly powerful. 5 minutes, I might actually do it. And you've got all these in your notes, so I'll give you on the memory stick, okay? You don't have to use all of them. Dentatox number 8 works absolutely brilliant. But if they've got swelling, give a drainage remedy. Flush the system clean. If they have continual problems and their immune system is low, this product, Cytomix, absolutely brilliant at just raising up TH1 and TH2. Sometimes, you know, when I showed you that from that regulation, everything's just low. You want to raise it up. Cytomix raises up TH1 and TH2 in a balance. It's beautiful stuff. So, this is how we look at it. So here, you are dealing with the actual problem. This is how they like to illustrate it. This is the actual problem, glue in a flam, glue in a throat spray. Drain the matrix, make sure you're flushing it all out, and then restore the TH1, TH2 imbalance. So you're looking at the whole system, not one remedy. Same with gum disease. Drainage and, you know, getting the bone right, getting people's hormones, because think of the people who are having gum disease. They're older people. You're not telling me their hormones are ideal. Just make sure all the hormones are balanced. Make sure everything's fine. You're not going to do them any harm. You're not going to get them pregnant if you're doing all of this. Now, they have some remedies, and I don't generally use these because it's where my license will go if I start saying to someone I'm going to chelate or get rid of mercury fillings. But you know, they have them. You can go away and read them. They have specific ones. They used to have specific ones for people who are allergic to composites to desensitize the composites as well. You're getting the mercury from the cells, plus you're making sure you can flush it out. Everyone who's taking cilantro or this, that, and the other to get the mercury out of the cell, well, think of the journey through the matrix, through the lymphatics, through the liver, through the gut. You know, you've got to support all of them. So these are protocols you can get before surgery and dental implants. And just treatments to support. Guna trauma, Guna flam, Cytomix if they're always worried I get infections. So these are things you can take afterwards. It's all about drainage, drainage, drainage. Get rid of the toxins that are there. But, last few slides, I promise. You've got to start today. Or you've got to go to the internet and give me the time, because tomorrow is a mystical land where 99% of human productivity, motivation, and achievement is stored. And that applies to me as well, until Dawn and Mike say, John, where's your bloody presentation? So, of course, I send it to them and say, it's too long. So I sent them the shortened version, which is what you've got, and I said I'd get this done. And I nearly have. This is where you can get more information from, folks. Okay? And you can go online and get your qualifications in it. So that's prmacademy.org. And I think probably for me it costs about £450, sorry. Some philosophical things at the end. About £450, so about $600. But you go online, you watch videos, and then you learn the whole thing. This is another form of medicine, and I think you should all do this as you leave. And Dawn has healed us so much. Hugging is a good medicine, so I think we should all be hugging each other. So that's one thing. And the whole thing is, and again, I want to leave you just a few thoughts. You only receive when you give. So I love giving because I get so much more from these meetings. And now it's over, I can have a beer and everything like that. But it all comes around, doesn't it, hey? So, you know, there is a serious side to me as well. We all have to do this. Be you. And I am desperately trying. If you'd have seen me a month ago, I had a plait in my beard, long hair. I had to conform because I was having some problems at work. But I still believe in myself, and I won the case hands down. And you know, that's the first slide and the last slide. Be crazy, stupid, weird and strange, whatever. Because life is too short to be anything but happy. Look at all the capital people. Thank you very much. Mike, 1201.
Thank you, John. That was a great talk. On behalf of IABDM, we'd like to reward you.
Thank you very much. I'll have a hug, please.
Okay, the code for this morning's lecture is JR1010. JR1010. And then and then for your lunch and learns, be sure to either write the topic or the speaker down in the space that from yesterday and today.
You guys need to go ahead and go over to lunch, find the table that you want, and eat, and then we'll be back afterwards.